Introduction. Hello, and welcome to this video on cervical radiculopathy. Cervical radiculopathy is a condition that affects the nerves in the neck and can cause pain, numbness, and weakness in the arms and hands. In this video, we will discuss the causes, symptoms, diagnosis, and treatment options for cervical radiculopathy. Causes. Cervical radiculopathy occurs when the nerves in the neck are compressed or irritated. This can happen due to several reasons such as a herniated disc, degenerative changes in the spine, or bone spurs. The condition can also be caused by trauma, such as whiplash, or by repetitive stress injuries, such as those experienced by athletes or office workers who spend long hours at a desk. Symptoms. The symptoms of cervical radiculopathy can vary depending on the severity of the nerve compression. Some common symptoms include pain, numbness, tingling, and weakness in the arms and hands. Patients may also experience difficulty with fine motor skills, such as buttoning a shirt or holding a pencil. The symptoms can be intermittent or constant and can worsen with certain activities, such as reaching overhead or turning the neck. Diagnosis. To diagnose cervical radiculopathy, a doctor will perform a physical examination and review the patient's medical history. They may also order imaging tests, such as X-rays, MRI, or CT scans, to evaluate the spine and the nerves in the neck. Treatment. Treatment for cervical radiculopathy depends on the severity of the condition and the patient's symptoms. In mild cases, rest, physical therapy, and anti-inflammatory medications may be recommended. In more severe cases, surgery may be required to decompress the nerve and relieve the symptoms. Other treatment options may include steroid injections or chiropractic care. Preventions include maintaining good posture, taking breaks from repetitive activities, and engaging in regular exercise to strengthen the muscles that support the neck and spine. Exercises for cervical radiculopathy. Neck stretches. Gentle neck stretches can help relieve tension and reduce pain in the neck and shoulders. To perform this exercise, sit or stand with your shoulders relaxed and your head facing forward. Slowly tilt your head to one side, bringing your ear toward your shoulder. Hold this stretch for 10 to 15 seconds, then repeat on the other side. You can also tilt your head forward and backward to stretch the front and back of your neck. Shoulder blade squeeze. This exercise strengthens the muscles between the shoulder blades and can help improve posture. Hold for 5 to 10 seconds, then release. Wall angels. Wall angels help stretch and strengthen the muscles in the upper back and shoulders. Stand with your back against a wall and your feet about 6 inches away from the wall. Raise your arms overhead and slowly lower them back down, keeping your arms in contact with the wall at all times. Repeat 10 to 15 times. Scapular retraction. Scapular retraction strengthens the muscles between the shoulder blades and improves posture. Slowly squeeze your shoulder blades together and hold for 5 to 10 seconds, then release. Chin tucks. Chin tucks help improve posture and reduce tension in the neck and shoulders. Sit or stand with your shoulders relaxed and your head facing forward. Slowly tuck your chin toward your chest, keeping your eyes and nose facing forward. Hold for 5 to 10 seconds, then release. It is important to consult with a healthcare professional before beginning any exercise program, especially if you have cervical radiculopathy. Your doctor or physical therapist can recommend exercises that are safe and effective for your specific condition.